All right, welcome back to Getting to the Root of It. This is a video podcast brought to you by Mental Dental and Colgate, where we talk with professionals in the dental field to provide background on the different career options available after graduation from dental school. And today it's my pleasure to be joined by Dr. Ahad Saqib, who is a cosmetic and restorative dentist who practices in Bethlehem, Pennsylvania. He graduated from NYU College of Dentistry in May of 2022 and completed his general practice residency in June of 2023. He's very passionate about dentistry, including every nook and cranny from the clinical aspects to the leadership opportunities. He hopes one day to have a lasting impact on our field for years to come. And I would say you're well on your way to doing that, man. So thanks so much for joining me today.
Thank you so much for having me, Ryan. It's my pleasure.
Yeah, absolutely. So you did recently graduate from a GPR, and congratulations on that, man. I'm sure it's still pretty fresh in your mind. So maybe we can start there and talk about that GPR a little bit. So what brought you to pursue a GPR after dental school?
So my biggest takeaway, I think, when it comes to like picking residencies, and why I chose a GPR is because like in dental school, I felt like, hey, like we got a good baseline, like a solid baseline to like what's kind of dentistry, and we not to hurt a patient essentially, but we don't really learn like the advanced skills or the soft skills with patients. And so I wanted to do take all of that and kind of expand my skill set in general dentistry and maybe focus on certain things which I know I didn't get the opportunity to do in dental school. So I wanted to do a residency which would allow me to do that. And kind of as I was like kind of talking to you earlier, Ryan, like not every residency is built the same way. So you really have to kind of look at what each residency offers and go with your kind of gut feeling on where you feel like you belong and, maximizing your year there. Because all GPRs and AEGDs, which we'll kind of get into later, have different experiences.
Definitely. So maybe we can highlight some of those differences about the GPR program. So if a dental student were doing their research and looking at the different GPR programs that are available, which there are a lot, how would
Mhm.
they begin to make those distinctions and pick, good GPRs from bad GPRs?
So what I'll say the biggest difference between an AEGD, which is your advanced education in general dentistry, versus a general practice residency, is that in AEGD there's no call, which is nice. It's a good and bad thing. And I would also say you get less hours, like in terms of, clinical exposure, because you're not on call with oral surgery or whomever, they put you on call with. And you also get kind of a less pay technically because I think the average, if I remember correctly, when I looked at it about a year and a half ago, was like AGDs range from about 40 to 50 and your GPRs from like 50 to 70. So like it does like have a slight pay difference because you're on call and like the hospital's paying you versus like the dental school or whatever they're paying you. So that's like the biggest difference is the on-call schedule and whether or not you have call. Now, to pick a good general practice residency, because that's what I did, is you need to go shadow. And I know it's hard in dental school to kind of get permission, but if you can email the programs that you're invested in or interested in, especially if they're close to home or close to your dental school, go shadow, go ask the residents, kind of cold call them on LinkedIn. Be like, hey, like my name is, pre or dental student so and so. I'm really interested in your program. Can you kind of tell me about it? Like, what's your call schedule like? Or what are some things you learned about, your program, or was it worth it? And 9 times out of 10, people are pretty honest about their program. They don't really, cut the bushes because they know what it's like. So it's good to get a firsthand experience. So if you can go shadow, go connect with people, and always just be connecting, I think you'll find the program that you want to go to. So in my hometown, how I got to it is like I knew I wanted to come back home, and I heard really good things about both programs. But what I actually did is I shadowed at each program like at least twice, and using those like context clues and like talking to the students, I mean the residents, I kind of figured out like, hey, I kind of want to go here versus here. And actually, the funny thing is, the program that I wanted to go to, I actually didn't end up at. I was actually at the other program, but honestly, it worked out either way. So And for me, it was just because one program had more technology, like CAD, CAM, and all the fun, cool stuff. But this program didn't have all that. But the beauty of that program was that I was able to tailor my experience in more cosmetics and like implants, which is where I want to end up anyways in.
Right.
And I was able to go towards that route. So my biggest piece of advice to any hopeful dental student aiming to do a GPR is do your homework, connect, and then go with your gut because no piece of paper, no program director is going to tell you XYZ. You got to find out for yourself and then make that judgment for yourself.
Hmm. Yeah, that's really great. You have to do your research and figure out what program is going to best fit you. And the best way to do that is to put yourself in the shoes of the people there and ask them. So that's really great, man. In terms of like qualities of a GPR, you mentioned the on-call feature of them. Should someone weigh like that more heavily, the clinical aspects, more the academic aspects, the where should their focus be if they're really making these decisions?
I personally would probably say you want a program that makes you clinically better. And I'll say why, because again, like in dental school, you learn the academics part. And the academics you can pick up from like reading a journal like JADA or like picking up like your implant journal from like AGD or something like that, Academy of General Dentistry. And that can just come with time. You can pick up a textbook. Like I have Mish's textbook here because I'm taking that course soon. Like you can pick up knowledge from anywhere. You just have to be willing to pursue it. So I think that as important as it is, I think you could do that on your own time. The more important thing is how many clinical faculty you have, you get clinical exposure. I think the more of that you have, and you maximize that year into what you want from it, getting faster at your dentistry, being better with patient communication. I think those are the soft and somewhat hard skills that you want to master in that year. So I always tell people, watch out for the on-call schedule. Like ask them how many weeks are required. It's every couple of days. What is required on call? And the reason I ask that is like there's a lot of programs out there that they don't talk about. And I could name the state, but I'm probably not going to, but they tend to push you into like OS resident spots because they don't have enough OS residents. So they just kind of fill the GPR residents and make them do just lacerations on call doing trauma. And it's like, yeah, it's cool to see, but if you're not going to oral surgery, then what's the point? Like you're not going to be dealing with this on a 8 to 5 Monday to Friday or Monday to Thursday schedule when you leave your residency.
Right.
So you want to really hone down on the on-call schedule. And if they start giving you shifty answers and like they're not like really being forthcoming, you know that something is wrong and you can kind of make that judgment. But if they have a really strong clinical background, like they let you place implants, let you work with OS on like bone grafting and uh, veneers and crowns and bridges, root canals, whatever, then that's a great program. And if you want to completely avoid the on-call schedule, then you just do an AGD because usually in AGDs they just focus on that clinical aspect, and that's wonderful. And on top of that, you'll also get your academic and literature stuff because it's usually based in a dental school. So like it really depends on how much risk you want to take, and as I said earlier, the research behind it because it really just comes down to finding out what you want to do and how you want to practice. And one piece of advice, sorry to keep this to such a long
Yeah,
answer,
that's great.
but what I would recommend is find a place you want to live in. And I know that might be hard for some people because some people are married, they have kids, or they're just not sure. But you want to go to a residency program where you can grow roots. And the reason I say that is because those faculty members that you interact with, the people that you connect with, that's your most valuable resource because dentistry, when you leave, is a very lonely field. It's the one field that you don't
Mm.
have a bunch of nurses and other doctors with you. You might have your owner, or your owner might not even be there. He might just throw you to the wolves and be like, "Hey, this is it." But you want to be somewhere where you either have family or connections or colleagues that you feel like a welcome community in, and you can grow from that because it's not what you know, it's who you know. And that is so key when you're picking a residency because if you say you want to live in Chicago, try to find a residency in Chicago. If you want to go in Texas, go find a residency in Texas. If you want to live in California, go do that. But find out and think about where you want to live. And it's a hard question to answer But if you know where you kind of want to live, that's the residencies you go for because you want to build that foundation early on. Because man, I'm telling you, it's so important. Like I can reach out to my perio clinical faculty. Actually, I had dinner with them last week, and I'm having dinner with my oral surgery faculty, and they're like, "Hey, like, tell us about prior practice. How's it been? Like, is there anything we can do to help you? Like, we'd love to catch up every couple of weeks. Like, let's treat you to dinner." Because they know you're a young dentist. They invest and they believe in you. They've seen your work, and so they want that feeling of belonging. So I
Mm.
always say to people, on-call schedule is number one, and number two, where you want to make your roots. Because if you have that, you'll be very, very happy, and I promise you, you will not regret that decision.
Mm-hmm. Yeah, that's fantastic, man. And it really works out well because if you go to a potential GPR to shadow, well, you're also in
Mhm.
that location and you can check it out and see if you want to
Yeah,
live there or not, if it's not in your current environment. So I think that's a great thing that people should really take seriously. And I know it can be difficult to take off time
yeah,
from dental school. You and I can both relate to that, but
yeah.
such a priority to make, especially that your clinical experience more broad and more just have more experience in that realm, like you're saying, because the academic opportunities are out there through lots of CE. The hands-on
Mhm,
courses are a lot more sparse and harder to find.
mhm.
And so that's really where the focus should be in terms of your continuing education in a GPR or AGD program. So that's great, man. Really, thanks for sharing all that. Maybe if you don't mind talking a little bit more to your GPR experience, what were some of the highlights and the challenges that you had in that program?
I would say my program was really good. And it's kind of in like Allentown, Pennsylvania, which is like, where's Allentown? It's like the Billy Joel song, and yeah, it is. But what I will say is the program here is really good because our directors are fantastic. Did we have some things lacking? Absolutely. But when it came to like material selection, cases you wanted to do, the faculty were phenomenal, very caring. I just felt that each time I interviewed there or went and shadowed, I just felt so warm and welcomed. I knew that it was either this program or this program that I wanted to go to. And it just is up to the match to kind of place you. But I was happy with my second choice. Like I had no regrets. So what I will say is my program had pretty much more strength than it had weaknesses. And I'd say like the only weakness we had, which is just kind of unfortunate, is that we lost our endo faculty just because he wanted to kind of scale back his own personal life and he couldn't
Hmm.
have anyone. But our general dentist stepped up and helped us with the endo, but we had ortho, we had a little bit of like, restorative cosmetics. The oral surgeons really stepped up, the perio stepped up. So honestly, like I would rate my experience like 8.5 to 9. Like I really enjoyed it. And I honestly advocate for anyone that really wants to be good, find a program where you feel at home because I promise you it will pay dividends. And honestly, once you kind of commit to that program and you know this is where you want to go, make your actions as well as like your words seem that, hey, this is where I belong and I want to be here, because the more you make it happen, the more likely you are to get like selected in the match system. So I would say the only weakness I probably would say is the whole endodontics faculty thing of like we just didn't have that. And that's normal. Like you're not gonna have every single thing, but if you get like 90 or 80% of what you want from a general practice residency, you're gonna be a whole lot better. And that's the whole point is you taking that additional year to just be a little bit better. And I think that's good for patient quality and outcomes and communication. So why not, right?
Hmm. Right. Absolutely. And it's funny, man, is I actually did my college, my undergraduate in Allentown, Pennsylvania. So I'm
Oh, did you?
very familiar with that area. Yeah.
All right,
Yes.
fair enough. I
Yeah.
grew up here. Like I've been here for 20, I was here for 22 years and I was like, I'm just gonna leave for a little bit and just come back and it's great. Where'd you go? Lehigh or
It's a great spot. I actually went to Muhlenberg
oh
College.
you're 10 minutes. I live 10 minutes from Middleburg.
Oh, really?
Yeah, I live
That's
in Northfield, so that's hilarious.
Oh, that's awesome. Yeah, I
Yeah,
haven't been up that way for a while since I'm down in the Charlotte area now, but yeah, I would love to go back because I had a really positive experience there. So,
yeah,
uh, yeah, cool spot.
yeah. It's a good spot. It's a good spot.
Yeah. Awesome, man. Well, That's a funny small world coincidence there. I
Yeah.
guess to end this time together, do you have any last advice for a dental student who may be considering a GPR or an AAGD? You already gave some great tips and advice, maybe just to summarize some of the highlights here.
I think when it comes down to picking it, kind of make like a list. Like, what do you want? Like, do you want the on-call schedule? Do you not want the on-call schedule? And kind of figure out, where you want to be, like I said, and just kind of like shift through the programs, go shadow. And once you kind of make that decision of where you want to go, just go full force for it because you won't regret it. I think honestly, the best thing is that you go in early, you figure it out early, and once you commit, you stay that course and you won't regret it at the end of the day. And that's like the biggest thing is like you should have no regrets when you're doing a residency because I think you're just more confident when you come out and you just feel like, hey, I've seen harder things in residency, so I can do this. So it's really all about building confidence. And sometimes you don't get that confidence built in dental school because as you know, Ryan, like some of our professors aren't the nicest people or they're kind of like, oh, like I could do this in 20 minutes. And it's like, but I'm just starting out. Like it takes me an hour and a half. So
Right.
it's about building that confidence and knowing who you are, knowing what you want. And when you go through that, I think it transforms you as a human, more than a dentist. And then the dentist thing just becomes easier, if that makes sense. So
Mhm.
do your research early, commit early, and figure it out. Because once you do, you'll be on a really like great path.
Yeah, that's great. And I remember something one of my faculty said when I was in dental school was the goal of these 4 years is for you to become a competent beginner, which is
Hmm.
that's a very valid point that there's a lot more that we've yet to see. And I
Hmm.
think the goal of doing a GPR is to become a confident, maybe not beginner, but a confident provider, build that
Exactly.
confidence part of it more than just being kind of baseline competent. So that's a great reason to want to pursue continuing clinical experience in that context.
Yeah.
But, despite that, we're going to learn for the rest of our lives. It is a lifelong learning profession, and there's always advances in technology, things we haven't seen yet. And so that's part of the excitement of it too, is that we're always going to be learning something new with
Yeah.
each year.
Absolutely.
Yeah.
Absolutely.
Well, thanks so much for taking the time to do this, man. It was great getting to chat with you, and I think the
Yeah.
listeners will take a lot away from it.
Yeah. Thank you. No, I appreciate you having me on, Ryan. It's been my pleasure. And you guys can always reach out. And I think it's just so important to just connect. And I, it's been a pleasure just being on here. So thank you again.
Yeah, absolutely. And if people did want to connect with you, do you have any resources or a website or social media that you want to
Um,
share?
so I do. I have an Instagram. I have a website. If you just put my like first and last name, you'll find it. It pops up. It's not hard. My Instagram's public. My website's public. You can look at some of the cases I've done. And honestly, like, just feel free to message me, email me. You can even call. I think I have my phone number even on my Instagram. I think so. Just feel free to just contact me through there, and I'm happy to answer any questions.
Yeah, fantastic. And I'll leave links in the description of this for all of that so people can reach out to you. Thanks for offering that. That's really great.
Perfect. Absolutely.
Awesome. All right. Well, thanks again, and we'll talk soon.
Thank you. Take care.